Hello, this is Alfred Brock with Wayne Focus. We're going to be going through some information today about some materials that have come to us from the Public Sectors Consultants Group, and their link is going to be down on the bottom here so that you can go take a look at it yourself. And the question they are posing is, what kills more Michiganders, guns, cars, or opioids? Well, you can't escape it, they say. Nearly every day there's the disturbing report or news story warning us about the worst drug crisis in American history, and that's the rampant opioid epidemic. And recognizing that no state, city, or town is immune, the public sector consultants embarked last year on a one-of-a-kind project with the Michigan Community Service Commission to map the assets, resources, experts, and tools being used by Michigan organizations to address the opioid crisis across the state. The resulting research will help the MCSC, as well as other key players in the fight against drug abuse, that's you and me, better understand where opportunities exist to positively impact opioid addiction. And just as important, it will tell us where there are gaps so we can try to fill them. So let's take a look at this. What's going on? One of the numbers they give us after that preamble is 140. Today's number for the number of Americans who die every day from drug overdoses, and 91 of those are specifically due to opioids. And that comes to us from the U.S. Department of Health and Human Services. 5 and 80. There's some two numbers for you. Well, the United States has 5% of the world's population, and we consume 80% of all the painkillers created. Okay, all the painkillers made, 80% of them, we consume them here in the United States. 99%. That's the percentage of physicians, of doctors, 99%. Who exceeded the Centers for Disease Control, the CDC, and prevention's recommend 3-day dosage limit for opioid prescriptions in 2016. So that's 99% of physicians exceeded the Centers for Disease Control and Prevention's recommended 3-day dosage limit for opioid prescriptions in 2016. And 23% wrote prescriptions for a full month. Now, 11.4 million versus 9.9 million. Okay. That's the number of prescriptions written in Michigan, 11.4 million. For painkillers. That was in 2015, 11.4 million prescriptions written for painkillers. And the total population is 9.9 million. So, more prescriptions written in the state than there's people. Hey, whatever. 32,473. That's the number of primary heroin and prescription opioid treatment admissions in Michigan in 2016. That amount has increased 4.8-fold since 2001. So 32,473 primary heroin and prescription opioid treatment admissions in Michigan in 2016. That goes along with it. You know, they got to go to the hospital, they got to get their insurance, their jobs are at risk, their families at risk. Let's not forget their own life at risk. 1,275, that's the number of Michiganders who died from opioid overdoses in 2015, 1,275. That's more than those who died from gun deaths in Michigan, which was 1,164. And nearly twice as many as those who died in traffic accidents, which was 840. And all three of those numbers are just totally unacceptable. 815. The number of babies in Michigan in 2014 who were treated for neonatal abstinence syndrome, which is caused by exposure to opiates in the womb, and that is double than it was in 2010. That's from the Detroit Free Press. I gotta tell you something about neonatal abstinence syndrome. The baby can look okay. It can look okay. The doctors could look at it. Everybody could look at it. The mom doesn't say anything. They take the baby home. It's got neonatal abstinence syndrome, and it does fine 3 to 6 days. It could die instantly. And but this is 815 of them who were treated for it. Not saying all the ones that had it. Nearly $10,000 versus $50,000. So the first number here we got is $10,000. The second number here is $50,000. That's the average cost of a hospital stay for a healthy baby compared to that of a newborn with opioid withdrawal. Now we got some numbers, some historical American numbers. 1840 to 1920, 1960s and 1970s, and the year 1999. These are the years when the first, second, and third opioid addiction epidemics occurred in America, swept across the country. In the first, an estimated 80 to 100,000 Americans were addicted, predominantly upper-class housewives, soldiers recovering from war wounds, and Chinese immigrant laborers. Okay, let's recall that we had 64,000 deaths last year, over 64,000 deaths last year. So this first opioid epidemic affected between 80 to 100,000 Americans. And in the second one, that's between 1960s and 1970s, all right, drug overdose deaths due to heroin peaked in 1970 at 80,000 deaths. 80,000 deaths, affecting mostly low-income youths living in urban settings, particularly non-white males aged 20 to 29 years old. Now, the current epidemic started in 1999, and users are now predominantly white, most often young males, and often live in rural communities. Women also are affected by this, so we're just giving you I'm giving you the quicks of the numbers that they gave us right now, and they're all terrible. And I hope you take a look at the link down below and the links in the link. And I want to thank you for joining us again today. And be happy, be healthy.